Coming up, after undergoing 7 procedures, Ann unveils her new look. And years after a childhood injury, Jimmy Smith gets corrective surgery. "29-year-old Jimmy Smith lives in suburban Atlanta."
I'm deaf. And I was born deaf because my mom contracted German measles, and that caused me to be born deaf. And the way I communicate with people is by writing back and forth. I also use ASL, American Sign Language.
Jimmy works part-time teaching American Sign Language, but he's had great difficulty finding a full-time job.
I've searched for jobs. I wanted something better, a better paying position, but people were afraid to give me a chance because I was deaf. They weren't sure about the background, the culture of deafness, and they didn't know what to do in terms of communication, so they didn't want to give me a chance. So that left me basically stuck in the same type of low-end paying job.
So it's frustrating to see my son not be given the same chances as hearing people.
Jimmy needs a good job because he has a child to support.
Being deaf, being a single parent, needing to have gainful employment is what Jimmy needs to do to survive.
But besides being deaf, Jimmy feels he faces another obstacle.
At age 3, Jimmy fell about 4 feet onto a concrete slab and fractured his jaw. His jaw never grew properly, and his teeth started coming in, and of course that resulted in a lot of problems with his teeth.
I wasn't comfortable smiling because my teeth had grown crooked and they were very crowded. Plus I had a small chin, so I wasn't comfortable with other people. And I also felt that if I smiled, they might make fun of me.
Jimmy began a journey to transform his appearance and underwent extensive dental reconstruction.
Jimmy initially presented to my office with a very difficult time smiling. After we completed the therapy for Jimmy, he was extremely happy and displayed that smile proudly every time I saw him.
Feeling a confidence boost after dental surgery, Jimmy was ready to do something about what troubled him the most, his underdeveloped jaw.
Well, I felt my chin was too small because an adult male has a normal chin. The shape of his jawline, it fits appropriately. But mine was too small. I felt it looked like a kid's chin. It didn't really match.
There's nothing Jimmy can do about his deafness, but he can change his jawline. He has decided to have plastic surgery.
When the surgery's done, I think people will really notice a difference. My teeth look better, and it makes my personality more open, so I'm sure people will really take notice. And maybe they'll give me more chances, at least I hope.
Jimmy consults with Dr. Brian Maloney, a specialist in facial plastic surgery.
Hi, how are you?
Great, welcome.
Thank you.
Well, fantastic. I understand they took some pictures for us today. So as we look at the face, the basic proportions of the face run from the upper third to the middle third to the lower third. And because the chin sits so far back, that lower third just kind of runs into the neck area. So by placing a chin implant, what we're going to do is to try to bring this chin out. And then also we can do a little liposuction underneath here. The liposuction is going to help to create as long of a jawline here. What do you think?
I think it'll be awesome.
For thousands of years, when a chin sits back from the lower lip, we've associated that with weakness, with frailty, and strong chins convey exactly the opposite, strength and leadership. And Jimmy is looking for that strength and leadership in his appearance.
I'm looking at you and thinking about you having a bigger chin, and I think it will make you look more like a man, a handsome man.
I don't want to be in competition with Jay Leno.
I'm sure they don't have an implant that big. But you're right.
Jimmy and his parents arrive at the surgery center.
What we're going to do right now is we're going to put some markings on.
He's taken to the OR.
And some oxygen on your face.
Our challenge today is going to be try to balance out the asymmetry in the jawline and give him as much definition along the jaw as possible. Just watch your step, slippery when wet.
Dr. Maloney makes a small incision and begins liposculpting under his jaw.
In most cases of facial liposuction, if we remove just even teaspoons, that's a lot.
Another incision is made under the chin for the platysmaplasty, a procedure to tighten the muscles in Jimmy's neck area. This will give him a more prominent jawline.
The platysmaplasty would be analogous to a corset, just running a stitch back and forth, trying to pull the sides together.
The incision is closed and the focus shifts to the chin implant.
But because of Jimmy's asymmetry, I need to get a better visualization of what's going on here. So we're going to go ahead through the inside of the mouth.
He makes a 2-inch long incision on the inside of Jimmy's lower lip.
And here it is. This is what we've been looking for. We can see the right side is fuller, so we're going to have to burr this down with a little drill before we put the implant in.
The asymmetry of Jimmy's chin is corrected by trimming the bone on the right side.
It's very important. Every single chin is a little bit different, and every implant needs to be customized for each individual patient. There's no one size fits all.
Dr. Maloney secures the implant with sutures and closes the incision.
One of the exciting things about sutures in the mouth is that they heal much faster than sutures in the skin because it's a moist environment.
Wounds heal faster in a moist environment because the white blood cells that aid in healing can reach the wound faster. However, when dealing with a wound in the human mouth, the incidence of infection is higher due to bacteria. In Jimmy Smith's case, the upside is he will have no visible scars. But he will have to be closely monitored during his recovery to make sure there are no complications.
After 1.5 hours of surgery, all of the procedures are complete.
With the liposuction, I was able to sculpt the neck area and give them a much deeper area underneath the chin, which is helping to give that whole jawline much more definition. This bandage will just help to give a little bit of extra support to those areas. We don't want a lot of fluid to build up.
How about Jimmy?
I'm fine, but I'm in a lot of pain. I'm still alive.
Next, will Jimmy's new chin boost his confidence? Atlanta resident Jimmy Smith was born deaf.
And I was born deaf because my mom contracted German measles, and that caused me to be born deaf.
At the age of 3, he was left with a stunted chin after his jaw was broken in an accident. He consulted with Dr. Brian Maloney to correct his underdeveloped jawline. Jimmy returns to Dr. Maloney's office for a follow-up visit.
Well, I can't believe it's been about a month. How's everything feeling?
It feels fine. It feels great. It feels normal.
And as we look at this picture, it's even more dramatic where we can see, well, we really had no definition. The lower part of the face just ran straight down. And now we've got a nice, strong chin and that fullness there. So I think one of the most dramatic things that I see is the definition that we have underneath the jawline. Jimmy, everything feels wonderful here. The implant's in perfect position.
Now that the surgery's done, I look more normal. My chin looks normal. It looks better, more mature. And I look like a man, an adult.
Jimmy debuts his new look for friends and family.
Hey, you look great.
I've seen a little cockiness in Jimmy since his surgery that I never saw before. He's very proud of the way he looks.
Yeah, I feel more open, I feel brighter, friendlier, and I think people will notice that. It's easy to notice. And I think they'll know that I have something good inside. For me, maybe in the future, there'll be opportunities for me to take advantage of. In fact, I know there will be.